Hello, my name is Ashley Austin, and my presentation for today is Understanding Depression in Children and slash Adolescents. It's recognizing a prevalent disorder, knowing what the causes are, how we can help, and what are the highest treatments. So to start off, the biological, cognitive, social, and psychological issues with depression in adolescence. The biological being the genetic predisposition, imbalances in neurotransmitters, and differences in brain structure and function can play a role in depression in adolescence. Social being peer rejection, family conflict, academic stress, and social isolation also contributes to or even induces depression in adolescence. Cognitive being negative thought patterns, difficulty with problem solving, and rumination are common, and psychological being low self-esteem, feeling hopeless, difficulty managing emotions, and past trauma are significant factors in this disorder. So some characteristics and features to look out for in adolescence when it comes to depression. Emotional could be persistent sadness, irritability, anger, anxiety, guilt, or worthlessness. Behavioral being withdrawal from friends and family or activities, changes in sleep patterns, whether it be oversleeping or undersleeping, as well as eating habits, being overeating or undereating, changes in weight, decreased energy, difficulty concentrating, and reckless behavior are very good signs of that. Um, and physical being headaches, stomach aches, and other physical complaints without a clear medical cause. So it's not a physical like rumination or physical attribute to this, it could be a sign. And here are some physical sign examples to go more in depth when it comes to depression in adolescence. There's feeling of worthlessness or hopelessness that might be an outward expression, loss of interest in things they used to enjoy, withdrawal, either going into their rooms or not talking to anybody, crying, especially being emotional or extra emotional in certain situations that wouldn't typically probe that. Inability to sleep or sleep too much, loss of appetite or increased appetite. So the prevalence for annual or lifetime when it comes to depression in adolescence, annual study suggests that about 4 to 8% of children and adolescents experience a depressive episode in their lives. It's very highly prevalent with approximately 15 to 20% when it comes to adolescents versus children experiencing a major depressive episode by at least 18 years old. Lifetime being there's a 10 to 20% of adolescents scoring when it comes to having a lifetime of depression. It's important to note that the figures are based off specific studies and stuff like that, and incidents are rising due to incidents like COVID-19 and pandemic and being isolated, most commonly seen in females. So, what would it be like living with depression as a child or an adolescent? Living with depression is very challenging, and especially for children and adolescents, it significantly impacts their academic success, social success, and just overall stimulation when it comes to their hobbies or finding joy. They might feel misunderstood, lonely, overwhelmed by their emotions, and daily tasks can become monumental, and their outlook on future can be very bleak when they have so much to look forward to as an adolescent or a child. So, some causes of depression when it comes to adolescence or the etiology, I'm pretty sure that's how you pronounce that. The cause of depression is complex and multifaceted, often involving a combination of genetic factors, being family history or DNA or just something biological, brain chemistry, being an imbalance in neurotransmitters, also biological, environmental factors, a stressful life, loss of someone that you love or a close family member, parental divorce, trauma, or adverse childhood experiences, and psychological factors being negative thinking styles, low self esteem, and difficulty coping with stress. So, some mental health resources, treatments, or interventions that we can do to help support those children or adolescents who have or are dealing with depression. It typically involves a combination of psychotherapy, medication, family therapy, or school-based interventions. Psychotherapy being cognitive behavioral therapy and interpersonal therapy are very effective. CBT helps children identify patterns, behaviors, and IBT focuses on improving relationships. Medication like antidepressants and like SSRIs are prescribed with qualified healthcare and often are put together with that psychotherapy that they use. Family therapy, involving a family can definitely help improve communication and support system when it comes to those struggling with it. And school-based interventions, if they're struggling at school, support at school can address academic and social challenges. And with some treatment statistics, I wanted to go a little bit more in depth here when it comes to treatment and how we can better improve the lives of those dealing with it. More of the statistics, and I did a little bit more research. Studies generally show that between 50 to 70% of young people who receive appropriate psychotherapy for depression experience a significant reduction in symptoms and achieve or even achieve remission. Antidepressants or medication obviously has a response rate of 40 to 60%, but it's crucial to note that medication is most effective when combined with psychotherapy, not just by itself. It often leads to better outcomes than either just treatment alone. And once you combine it with psychotherapy and medication, there's often a reach of 60 to 80% success rate in terms of symptoms improvement or even remission. And factors that may influence the success rate, although the percentage is fairly high, bless, are some factors that could influence this. It could be the severity of the depression. More severe depressions might require more intensive and long-term treatment and have a lower immediate remission rate. Duration of treatment, how long they or the person decides to take that treatment, or it typically works better with long-term outcomes and long-term treatments. Adhering to the treatment, how consistent the child or the adolescent is with their therapy and their medication, and comorbid conditions, whether it be if they are also dealing with another disorder or living with another disorder, and can sometimes make treatment more complex, and but they can also be treated, which is amazing. And the support system, if they have a strong support system, or if they do not, at home and school can also enhance treatment success. How to help. Here are some tips on how to help with those children or adolescents dealing with depression. Just be present and listen to them. Make yourself available to talk. Don't force it though, and let them know that you're here without judgment. Validate their feelings, avoid dismissing their emotions, and even if they seem disproportionate to you, offer reassurance. Let them know that they are not alone, especially. And normalize seeking professional help. Explain that it is okay to seek help and to seek treatment, and it's a way to get better and feel better. So, just a conclusion and the overall takeaway of my presentation, that depression in adolescents and children, it's complex. It involves a mix of biological, psychological, social, and environmental factors. It's recognizable. While these symptoms may vary, they significantly impact a young person's life. It's common. A significant number of children and adolescents experience depression, making it a public health concern. It's manageable, but it's manageable. While with the right interventions, including psychotherapy and medication, the majority of young people can experience significant improvement and recovery. And early intervention is crucial. The sooner, the better the outcome tends to be, and the less impact it has on their long-term development and well-being. Thank you so much for listening and watching my slideshow, and I hope everybody has a great day. And here is my reference slide. Good day.